Pendleton Place has served the community for the last 37 years. We are a place that was created by the community for the community. We have provided a home for children who have been abused and neglected by those who, quite frankly, are supposed to care for them, their parents, their grandparents, their caregivers. We ensure that medical, physical, school, and all other needs are met for the children that come into our care. Last year, 2011, 168 children were served by Pendleton Place. That equates to over 7,000 nights of care and well-being for children. There will always be a need for a safe place like our residential program for children who have been hurt by abuse and neglect. However, the need for residential care is less now than it has been in the past. Therefore, Pendleton Place Children's Shelter will now become Pendleton Place for Children and Families. We will now serve the child, their parent and caregiver, and their family, and look at the whole picture of what's best for children and families.
The relationship between the United Way and Pendleton Place historically has been one based on funding, program funding. In recent months, and actually recent years, we have created more of a collaborative relationship, looking more at some of the systemic issues within the communities that Pendleton Place serves, and I think that serves us well both from a funder's perspective but also from the perspective of the United Way wanting to really get to root causes and solve those root causes.
Presently, I'm a child abuse pediatrician with Greenville Hospital, and I work here at Pendleton Place doing the medical exams for the children that come here after they've been removed, their initial exam and ongoing medical care. The children that we see here in foster care coming in for their medical exams, most of the time we don't have any of their medical information. So a lot of times I could be talking to 3- and 4-year-olds asking them if they've ever been in the hospital. We often don't know what medications they're on, what previous surgeries or ongoing medical illnesses they've had. So it's really hard to understand exactly what we need to treat if we don't know what they've already had evaluated.
We are collaborating with South Carolina DSS, Greenville Hospital System Children's Hospital, and United Way of Greenville County to establish an innovative, first in the Southeast, Family and Child Assessment Center.
What that will do will be a much more comprehensive evaluation for the children coming into foster care, not only to assess their medical needs, which we will have the parents to help give some detail about that, but also to assess the developmental needs of the child, the mental health needs, the medical needs, and the dental needs, so that we can make a much more comprehensive plan for that child as they move forward. The other part of the program, it will evaluate and assess the family that's involved, the parents and foster parents, to help guide what kind of programs they need and decide if the child will be staying or where they'll be going, and make sure whatever home that the child's in is going to be a safe and effective home for them.
The idea that the Family and Child Assessment Center is really a good way to identify the service needs for for a child and a family up front. Far different than the way we typically do work in the nonprofit sector. We're typically very reactive, and in many cases that creates a drag on the system, certainly a drag on resources. To get it right as good as we can up front provides us the opportunity to serve the child, serve the family, and eventually serve the community far better, and then to leverage the limited resources we have. So I applaud Pendleton Place for taking that step. The other piece is the idea of the supervised visitation program, the family visitation program. I think that's a great program, and again, while it might feel like child welfare is forcing the change, it really makes sense if you think about this idea of reunifying families.
I've been involved as a guardian ad litem with children for 22 years and have really enjoyed the ability to work with kids and make their lives hopefully better than it has been in the past. We knew for a long time that we needed some changes in the visitation process when children are removed from the parents or when they're not with both parents because of divorce. We knew there was a place needed that would give a convenient, conducive place to work with children and their parents.
When Nell Stewart approached us about starting a family visitation and safe custody exchange program, we saw this as a perfect fit to meet the needs of children and families. These programs will be a part of our Family Bridges, the second piece of the puzzle.
When a divorce takes place, oftentimes there is bitterness between the two adults in the situation. And the children are confused by that because they love both parents. And sometimes there's violence involved. And children need to be in a place where they don't become the pawn between the two parents. So they desperately need a place that is safe for them so that they aren't going to see the parents fighting when they're exchanging custody of those children. They need the security of both parents, and they need the security of being transferred from one parent to another in a place where they feel comfortable and safe.
John I. Smith Supportive Services is our strategy to provide both residential and community-based services. Pendleton Place is located in the midst of a high-need area. Our residential program will provide 19 beds that serve children throughout the upstate, whereas our community-based program will provide services targeting middle and high school youth, many of whom will reside or live with their families right here in West Greenville.
We just make sure that, they have clothes, they go to the salon to get their hair done, the barbershop. We really want them to feel as if when they leave our agency to go to school, that no one can distinguish them from being at home. In the past, a lot of children who've been in foster care have aged out of the system and they had nowhere to go. They returned to the agencies that assisted them, still needing help. So I think it'll be very important for our agency to ensure that we implement skills that they will be able to be self-sufficient once they leave our program.
Child welfare has changed dramatically across the nation, and here in South Carolina, we are no different. We in South Carolina have to be leaders in taking or addressing the needs of children and families. In the past, organizations like ours served just the residential needs, and we were one part of the child welfare framework. Today, we need to be more diversified, we need to think more comprehensively about the whole child, their parent, and their family.
It's important that the community fully support Pendleton Place for the future of our children. And basically, the future of our children is our future too.
These children that leave Pendleton Place, they go back into the community.
Those children are going to be responsible for my future when I'm unable to be responsible for it myself.
If giving a hand up resonates with a donor, resonates with a corporate foundation, resonates with a philanthropic organization, Pendleton Place is a very worthy place to make that investment.
Our mission is to keep children safe
and support families in crisis
through prevention, assessment, and intervention.
Our vision is a community where children are safe,
families are strong,
and victims become whole again.